I'm now going to hand over to Sinead. Now, Sinead is a Macmillan nurse, but with some expertise in benefits that we might be eligible for. Okay, so hand over there. You got my, yeah.
Good morning, and thank you so much for your wonderful welcome. It's a real pleasure to be here today, and thanks for your attention. My name is Sinead Garry. I am a team leader on the Welfare Rights team on the Macmillan support line. What I'm here to do today is to give you a little overview of the Macmillan support line, an overview particularly of the financial support teams on the support line, the Welfare Rights team support offer, a brief introduction to benefits, a brief discussion about benefit applications under the special rules for terminally ill people, PIP in particular, benefits while you're in hospital. I'll give you a couple of examples, different kinds of benefits, and then we'll have some time for Q&As. So I will be needing to leave before lunch today, but after this, I believe we have a coffee session coming up. I'll make myself available if anybody has any specific questions during that time. First of all, as well, before we go any further, I would like to apologise to anyone who was on the third floor and heard me screaming my head off at the rugby, because I'm Irish and it was very exciting. Okay. So the Macmillan support line is available from 8 a.m. until 8 p.m, 7 days a week through bank holidays as well. We also have the online community, macmillan.org.uk, where you might find discussion groups, forums, things like that, emotional support, as well as some clinical questions, things of that nature as well. We have on the support line, we have cancer information nurse specialists. We have cancer information and support. They cover kind of a wide variety of things. If you're looking for support groups in your area, for example, they would point you to ALK Positive. We have a work support team for anybody who's having difficulty in their employment. We have the financial guidance team who can help with products like insurances, mortgages, that kind of thing. We have the energy advice team, and we have the welfare rights team, which is far and away the biggest team on the support line. So our energy advice team can provide information on energy company support schemes. Some energy companies, such as British Gas, for example, have a support scheme in place for people who are struggling with paying their bills or who have debt as a result of their bills. Trust fund support, boiler schemes, if your boiler's coming to the end of its life and you need to replace it. Water company support schemes. A lot of people don't realise that a lot of the water companies have support schemes in place for people who are struggling, especially if they need to use more frequent water for washing or for laundry, that kind of thing. Those support schemes are in place as well. And also considerations about your tariff and maybe getting a set tariff on your water. The financial guidance team is not actually a financial advice team. So they can give guidance, but they're not regulated to give full financial advice. They can give impartial information about pensions, accessing pensions early if you're retiring on the grounds of ill health. They can give information about insurance, including travel insurance. They can give information and guidance about mortgages, including things like what does it mean to take a payment holiday? How is that going to impact your mortgage going forward? They can talk to you about banking, about making a will, about estate planning, including power of attorney and dealing with probate after somebody dies. The welfare rights team, this always makes me smile because that man is actually a good friend of mine, and he's for some reason turned up in all of the Macmillan literature everywhere, and he hates it, and I find that very funny. So the welfare rights team, the main thing that we do, the main reason why people come to us is for income maximisation. We'll go through any benefits that are available. We can also give a little bit of advice about any grants that might be available, government support schemes, things like that. We can give advice and information on personal independence payment, universal credit, pension age benefits, employment and support allowance, Macmillan grants, and we can offer casework to support people who are going through things like benefit mandatory reconsiderations and appeals. Just to give you a little example about somebody who's come to the Macmillan support line, we've got Stephen's story. So Stephen was receiving employment and support allowance of £84.80 a week. His illness meant that he was feeling the cold more often, but he was worrying about the cost of keeping his home warm. Eventually, he became unable to pay his bills and buy groceries. He ended up very worried about his financial circumstances. He phoned the Macmillan support line and spoke to an advisor. So the Welfare Rights team, speaking to Macmillan, helped him to apply for and receive employment and support allowance of £129.50 a week, a universal credit of £45.61 a week, personal independence payment of £172.75 a week, and a Macmillan grant of £350 to help with increased costs. So Stephen ended up better able to manage the cost of his cancer. His overall weekly funding went up from £84.80 a week to £347.86 a week. The team provides a casework service. We're accredited by AQS, which is the advice quality standard. We can provide benefits advice with casework as a result of that. We can assist with things like filling in complex forms, challenging negative benefit decisions, representing at social security tribunals. This would be, just to clarify, not attending in person, but we can attend by telephone or by video. We can help with overpayments, and we can help with backdating of benefits as well. So the Macmillan grants, this information is correct at time of print, but the rules are going to change on the 2nd of October. At the moment, they're one-off payments of £350. That amount is actually going down because we've had incredible demand for Macmillan grants over the last couple of years, as I'm sure everybody understands, with the cost of living going up by quite so much. Over 48,000 beneficiaries per year, and grants are awarded for any additional cost that you have as a result of your cancer diagnosis and treatment. So it can be for heating, clothing, cost of a new bed or a new mattress, especially if you've got something like bone metastases, it can be very uncomfortable. Basically, any additional costs that you have as a result of your cancer diagnosis or treatment, we can apply for a grant for. There's very few restrictions. So I'm going to give you a little gentle canter through the world of welfare benefits at the moment. So the benefit system is enormously complex. It exists to provide financial support for people who are unemployed and looking for work. It can also provide help for people who are on low earnings, if they have a disability, if they're bringing up children, if they're retired, if they care for somebody, or if they're ill. So I'm going to go through, in your tables, if you don't mind, you've all got some pens and paper in front of you. Just going to go through a little bit of a true or false. Actually, you don't need the pens and paper yet. This is just a true or false. We'll be coming to the hard questions in a minute. So, true or false, everyone with a cancer diagnosis is entitled to a benefit. True. That is, in fact, not true. There is no single cancer diagnosis, there is no single benefit available that guarantees you a benefit if you have a cancer diagnosis. I'm getting contractual sick pay. Can I claim any benefits? Yes? Oh, sorry. I can't claim any benefits. That is not true. You can claim benefits if you're getting contractual sick pay. There are benefits available through that. So I'm terminally ill. My claim for PIP will be fast-tracked and paid at the highest rate without having to assess my needs. True or false? That's true. That's true. So I said that there's no benefit that you can claim if you have a cancer diagnosis. There are benefits that you are automatically entitled to if you have a terminal prognosis of less than a year. So I'm caring for my mum who's terminally ill. I work 10 hours a week. I can get carer's allowance. True or false? True. That is true. I'm on statutory sick pay. Can I get help with my rent? I can get help with my rent. True or false? It is true. Yes, it is. And I'm in receipt of means-tested benefits. but I can't get any help with my mortgage. True or false? It is false. How valuable that help is going to be is another question entirely, but I'm not in front of a group of welfare rights advisors, so I'm just going to let that one go. Okay. I'm in receipt of means-tested benefits. My husband has recently died. I can get help with the funeral cost from the government. True or false? It's true. Okay, that's our little true or false. Just to give you a little overview, there are basically different classes of benefits. I'm going to take you through, first of all, the non-means tested benefits. Under non-means tested, it doesn't matter how much you have in the bank, it doesn't matter how much you have in savings, and even if you're still getting paid from work, you may still qualify for a non-means tested benefit. So contribution-based benefits are benefits that are claimed to replace earnings. The entitlement depends on the amount of national insurance paid during your working life, or in some cases, your spouse or your civil partner. The employment-related benefits are paid by the person's employer. Don't directly relate to national insurance, but you have to be earning enough before you can get them. That's something like statutory sick pay. Also things like statutory maternity, paternity, adoption. Non-contributory benefits for special circumstances. That might be things like, I won't go into all of the different benefits here, sorry, I'll just move on. So if you fit a certain group, regardless of your earnings or income, you may be able to claim non-contributory benefits for special circumstances. And then under the umbrella of means-tested benefits, these are benefits for people who do not have enough money to live on. And a means-tested benefit can be claimed at the same time as a contributory benefit. Some of them will overlap, some of them will not. But there are benefits that are often claimed on top of other benefits to bring your earnings up to a certain level or your income up to a certain level. So back to the contribution-based benefits initially, these are the benefits that are paid to replace your earnings. You can have employment and support allowance. That's a contributory benefit based on your national insurance, but only based on the national insurance you've paid in the previous 2 tax years. So your employment-related benefits are things like statutory sick pay, statutory maternity, paternity, adoption. Your non-contributing for special circumstances, we're talking about, in a lot of cases, the disability benefits. So for working age claimants, anybody between 16 and state retirement pension age, you've got PIP. Anybody over state pension age is attendance allowance. For anybody aged under 16, disability living allowance. You can also have non-contributory benefits if you're a carer, if you qualify for carers allowance. And in Scotland, PIP has been replaced by ADP, Adult Disability Payment. Do we have any people from Scotland in the audience? Yes. So yeah, some of the benefit rules are a little bit different in Scotland. Scotland's benefit system is slightly less horrendous. I won't say it's more generous. It's just less awful. And then the means-tested benefits are people who don't have enough money to live on. So for working age claimants, you've got universal credit. Universal credit has replaced all of the income-related benefits for working age people. So benefits that you may have had before, such as income-related employment and support allowance, income-related job seekers allowance, tax credits, working tax credits, child tax credits, are all being replaced by universal credit. This replacement is something that's happening over a period of several years, and it's one of the main reasons why the benefit system is so incredibly complex at the moment. Until we're working on a single system, things are going to be very confusing. For people who are over pension age, we're looking at pension credit. For people who are in a mixed age couple, one person is over state pension age, one is under, it will be universal credit. Income support or housing, income support is gone by the by, but if you've been on it for a while, you may still be receiving it. Housing benefit and help with NHS health costs. So if you're on a low income, you have an automatic entitlement, if you're in receipt of means-tested benefits, to things like help with the cost of travel to and from hospital for your appointments, help with wigs, things of that nature, NHS health costs generally. This is the bit where you need your pen and paper. Okay, so we've got some situations on the left-hand side of the screen. And what I'd like you to do is to just take 5 minutes, talk to the people on your table, and match the situations up to the benefits. So the situations are, for people of working age on a low income, the benefit replaces housing benefit, income support, tax credits, ESA and JSA. Second one is a benefit for under 16s. Third one is for people over pension age who have difficulties looking after themselves. D is a benefit for people who are unable to work due to ill health or disability. F is the means tested benefit for over state pension age. And G is people who look after a disabled person. So I'm just going to give you 5 minutes to look at that, and then we'll have a look at the answers. Okay, have you had a chance to try and match up those benefits to the situation? Okay, everybody back in the room. Are we ready? Ready to get the answers? Now then, people of working age on a low income, what was that benefit? Sorry? A. A is 5. A is 5. So my clicker wasn't working then. Okay. B, what number was B?
3.
B was 3. And the potential amount of DLA is £172.75. Okay. Letter C. What do we have for C? 2 is correct, and the maximum amount of attendance allowance is £101.75. Okay. D. D is 6, and the maximum amount of ESA is £129.50 a week. For E, oh, I've just given you the answer accidentally. Okay. This is quite possibly one that many of you are familiar with, either through having claimed it or through having attempted to claim it. And the maximum amount of personal independence payment a week is £172.75, same as disability living allowance. So letter F, means tested for over pension age.
7.
We're running out of options now, so 7 is correct, pension credit. And the maximum amount of pension credit for a couple, £306.85 a week. For a single person, £201 a week. And again, I've given you the answer before giving you a chance to shout it out. So G is 4, that is carer's allowance, and that's £76.75. Again, there are different rules in Scotland. So the carer's allowance in Scotland it's called something else, and it's slightly more than this as well. So that's kind of a general run through the different benefits and what the amounts look like for somebody who may be looking to claim benefits. There are also special rules for people claiming benefits if they're terminally ill. And what do we mean by terminally ill? Again, it's different in Scotland. If you have a terminal prognosis in Scotland, you're considered to be terminally ill. Everywhere else in the UK, you're considered to be terminally ill for the purposes of special rules if you have a prognosis of less than a year. Prognosis is an incredibly difficult thing to predict. If you make a claim for benefits under the special rules for terminally ill people, you'll be awarded benefit for 3 years before you have to come back and provide further medical evidence. We have people coming back to us literally every week who made a claim under the special rules 3 years ago and now have to provide another report to get the benefit again. I've been speaking to people recently who've said that they've been issued PIP under special rules 3 years ago. They have the same diagnosis, they're having similar treatment, but they've been turned down on this occasion. So I understand that this is a bone of contention for a lot of people in the room, and I will be making myself available to answer questions if anybody has any questions at the end. The special rules for terminally ill people apply to employment and support allowance, universal credit, personal independence payment, and adult disability payment, disability living allowance, and attendance allowance. In order to access a claim for benefits under the special rules, you need to have a report that is completed by a competent medical professional. Usually this is a consultant, cancer nurse specialist, or a GP. If a SR1 form is sent in, then you don't need to go through any kind of an assessment in order to get the benefits under the special rules. You do, however, still need to make a claim for the benefits. Having a prognosis is not an automatic thing. You do still need to contact the Department for Work and Pensions and put in a claim for the benefit that you're requiring. So let's talk about PIP. So the question being, why do some people with a lung cancer diagnosis get PIP and others do not? The answer to that question is that we don't know. It depends. It depends. Basically, a decision is made by a decision maker at the Department for Work and Pensions. That decision maker is not a medical professional. They are an administrative professional. They may have picked up some information about different conditions over the years that they've been working, but they don't have medical knowledge and understanding, and they're relying on the evidence that's sent in to support the claim. The main thing that you can do if you have a terminal prognosis is to provide an SR1 form. That's the main thing. In Scotland, it's a BASRIS form, slightly different again. But that's the only time that you will be guaranteed to receive PIP, is if somebody has made the decision that you have a terminal prognosis, that you're expected to survive less than a year, you can then make a claim for PIP. You will only get the daily living component automatically. You still have to provide evidence to get the mobility component as well. So even if you get the mobility, even if you get the daily living component automatically, some of you will have the mobility component and some of you will have been turned down. But are there things that you can do to increase your chances of getting PIP? And the answer to that is absolutely. The first thing is to know the rules. If you don't have a Form SR1 that's been completed by a medical professional, you won't be qualifying under the special rules. So you need to know what the normal rules are. There's an awful lot of information out on the website about what the rules are for PIP. One of the best sources of information is obviously the Macmillan website. It's pretty good, but the Citizens Advice Bureau website is also very good, and it has a range of resources there as well to help you to prepare for filling in the PIP form, to challenge a decision looking for a mandatory reconsideration. They have sample forms and diaries available. I would always advise anyone who's making a claim for PIP under normal rules to consult a benefits advisor. The PIP booklet, if you're claiming under normal rules, is quite thick. It has several questions in it, and unless you know what it is that they're specifically looking for in the answer, you may give them a lot of information, but it still might not be the evidence that they need to make the right decision. I would always say consult a benefits advisor. It will vastly increase your chances of getting PIP. Keep a diary of your symptoms if you're making a claim under normal rules. So the normal rules for PIP, you need help with your daily living activities. You need to have had these needs for at least 3 months, and you have to expect to have them in 9 months' time going forwards. You also need to have the difficulties more than half of the time. You are assessed on a range of daily living activities, and the degree of help that you need for each of the activities then contributes a number of points. And if you cross the threshold for points, you'll receive PIP. If you come under the threshold, you won't receive PIP. You'll also be expected to be able to do those activities as often as you need to, safely, and within a reasonable amount of time. So quite often we have people who make a claim for PIP, and the question asks, do you need help washing and bathing? And somebody says, no, I can wash and bathe myself. But what they don't actually say is that they wait until there's somebody else in the house before they go for a shower, in case they slip or fall or need help. And they might not say, well, I can wash myself, but it takes me an hour because I need to go into the bathroom and I need to sit down before I can get up and go into the shower, and then I need to sit down. So unless you know what the question is actually asking, it can be quite difficult to give them the right information. If your condition fluctuates, it's best to keep a record of how your symptoms affect you over the course of a couple of weeks. The more evidence that you have going in, the better. So keeping a diary of your symptoms, and keeping a diary not just of your symptoms, but of the impact that this has on your daily living, then you have some more evidence to go in with your PIP claim, and it might make a difference one way or another. If you request medical evidence in support of your claim and send that in with your form, you have an increased chance of being awarded PIP. Like I say, PIP decision makers are not medical professionals. They don't have a huge range of medical expertise. They might not understand how your condition affects you. They are dealing with a range of disabilities every day. They're processing forms that are coming in from people who have spina bifida, and people who have MS, and people who have recovered slowly after surgery. So they're not cancer specialists. They don't understand all your symptoms. Any medical evidence that you can send in support of your claim will help your claim, but only if it's relevant medical evidence. Sending in information that's not relevant or that contradicts what you've already said will not help your claim. And again, this is where a benefits advisor can give you some guidance, what to send in support of your claim. Keep a copy of everything that you send to the DWP. If you make a claim for PIP, and you've made the claim for PIP under special rules, if you made the claim for PIP under normal rules, and your PIP is being reviewed, they'll send you out a form that says, have your circumstances changed since the last time you made a claim for PIP? Quite a lot of the time, you won't remember what you've told them the first time round. You might not have kept detailed information about what kind of symptoms you had at that point. That was 3 years ago. 3 years is a long time. So keep a copy of everything that you send to the Department for Work and Pensions, and then when it comes to renewal, you can have a look and say, actually, yeah, my symptoms are pretty much the same, or the difficulty that I have with my daily living activities are the same as what I told them 3 years ago, or it might have changed. The other thing is that if they make a negative decision, they will send you out a reason for their information. If you can contradict, you say, no, I told you this, and your assessor said this is where the discrepancy is, it's easier to challenge a negative decision. So keep a copy of everything if it's possible to do so. If you've done everything that I've told you above and you still get a negative decision, then challenge the negative decision. 68% of PIP cases at tribunal are overturned by the tribunal. That's a very high number of people that were turned down wrongly. The problem with that is it takes energy to fight this fight. So again, I would say consult a benefits advisor for help with this part of your battle, because it's not an easy thing to do. So I will, as I say, make myself available for people who have questions. I'm expecting particularly maybe questions about PIP. But we're going to move on to the next bit then, which is how your benefits are affected by a stay in hospital. So if you're staying in hospital for more than 28 days, the daily living component of personal independence payment, or ADP, will be stopped. Attendance allowance will be stopped because there's no mobility component for attendance allowance. That will just stop. And disability living allowance as well. Other benefits may also be affected. So if your PIP is the reason why somebody else is claiming carer's allowance, that carer's allowance is going to be affected as well. Now, rules about benefits in hospitals only apply to NHS hospitals. And doesn't apply if you're in a hospice, unless the hospice is an NHS hospital. The rules around what is and isn't a hospital are very woolly. There are a lot of issues with, one of the reasons why welfare benefits are so complicated is that a lot of the things that we're talking about are not in fact defined in law. And so there's an argument to be made. We do a lot of arguing. We're very argumentative people. So if you're not sure, contact a welfare benefits advisor and we'll go through all the rules, and then at the end of it we'll say, I'm not really sure. Have a punt anyway. We'll help you if they say no. So what support a terminally ill cancer patient might receive depends on your financial circumstances. So if you have an SR1 in place, you can get personal independence payment, disability living allowance, or attendance allowance, depending on your age. Under 16 is disability living allowance, personal independence payment is 16 to state retirement pension, and attendance allowance is over state retirement pension. For the Scottish people, this is a BASRIS in place, and it's personal independence payment, disability living allowance, no, adult disability payment, disability living allowance, or attendance allowance. If you have a terminal prognosis and you've paid sufficient national insurance contributions, you could qualify for employment and support allowance. One thing, just to complicate matters for you, if you're of working age and you have access to your occupational or private pension early, this could affect your employment and support allowance. If you have low income or savings, you may qualify for universal credit or pension credit, depending on your age and the age of your partner, if you have one. If you need help with rent, you can get help with that through your employment and support allowance claim, or if you're over pension age, housing benefits. If you're responsible for a child, you can receive child benefit. If you're on an existing claim, what we call legacy benefits, you can potentially be in receipt of child tax credits. You can't make a new claim for child tax credit. Child tax credit is now under the umbrella of universal credit, along with everything else. You may qualify for free school meals for your child. And if your child has care or mobility needs, you may qualify for disability living allowance for your child. So other financial support that may be available to you is things like NHS health costs. That's travelling to hospital for your appointments, wigs, prostheses, that kind of thing. Carer's allowance may be available for your carer if you have one. Having a terminal illness yourself also does not stop you from being a carer for somebody else. We recognise that care can cover a variety of things. If you have a terminal prognosis and you're providing emotional care or emotional support for somebody else, and that support is there for them 35 hours a week or more, you can still qualify for carer's allowance in your own right, and don't let anybody tell you any different. Industrial injuries disablement benefit, Macmillan grant, vehicle tax exemption, and other benefits. We can also talk about things like a blue badge, a toilet card, the just can't wait cards. If you have continence issues, you can keep a card in your wallet that you can show to a shop or a restaurant and ask them to allow you to use their toilets, and also a radar key to access disabled toilets. So there are lots of different ways that the Macmillan support line, the welfare rights team, can support you. These are some resources that you might find helpful. You have the Macmillan Cancer Support website. There's a web chat function on there. You can send a direct email to the welfare rights team, or you can call the support line. It's probably the most effective way of getting in touch. There's the online forum, the Macmillan online community. There's a lot of support available on the Macmillan website. Help for households is the government cost of living support that's available. You might want to have a look at that as well. Gov.uk website has some information that might be useful to you, especially about special rules if you think they may apply to you, if you think you've been incorrectly told that they don't apply to you. And the Personal Independence Payment Toolkit on the Gov.uk website. Personally, I think the one on the Citizens Advice Bureau website is better. And then there is an online calculator on the Macmillan benefits page on the Macmillan website. It's relatively long process to go through that benefit calculator. I would almost, in every case, advise you to call the support line instead. In fact, they're working now. You can call them right now if you like. They might be able to answer your calls. Okay, so thank you for your attention and your participation in this talk. Does anybody have any questions for me now that are general questions rather than specific questions? Yes.
On one of your slides, you said about assistance with boilers. Hi, you mentioned about boiler assistance. Does that apply to us guys with stage 4 lung cancer?
It can apply, it depends on the scheme, it depends on where you're living in the country. There are a number of different schemes available. So it's the energy advice team that deals with things like the boiler schemes and help with the cost of heating and water and things like that. Generally speaking, to speak to the energy advice team on the Macmillan support line, you'll need to have spoken to the welfare rights team first. That's always a good place to start. So yeah, it depends. There's no kind of one blanket scheme that's in place to help people replace their boilers. It will depend on a number of different things, such as your supplier, where you are in the country, and in cases, depends on your income and savings as well.
Okay, thank you.
Yes.
I get carers allowance at the moment, looking after Terry, but I get my pension in January, so that will stop. But somebody said or mentioned that maybe attendance allowance might come into force then, or does it just stop completely?
So carers allowance will stop
Yeah.
at state pension age.
Yeah.
Attendance allowance, although it sounds like it might apply to carers, is actually a disability benefit.
Okay.
So the attendance allowance will be claimed by the person who has the disability rather than by the person who cares for them.
Right.
If you've been receiving carers allowance and you're still caring for somebody, then you retain what's called an underlying entitlement to carers allowance. And that can mean an additional element if you're claiming any means tested benefits, things like council tax support as well.
Okay. It just seems a bit, you know, because I'm not going to stop caring, am I? Well, hopefully not.
That also depends, I think.
I got a question about how to find a benefit advisor. So basically, with my experience, when my husband got diagnosed, at some of the benefits, especially like PIP, it's better to apply at the beginning when we got the diagnosis, not halfway through, maybe after a couple of months or year along the line. So one thing is that at that point, from the first point of contact, Macmillan support or anything from through the oncologist or the nurse specialist, it's important to get that advice from day one.
Yeah.
And like now we are after, say, a couple of years, so it's time for us to renew it again. And then we are thinking, oh, they've been living for this many years, so how do we kind of apply after 3 years? So if there's any question, it's good for us to have access to a benefit advisor. So would you suggest going through to a benefit advisor through Macmillan or Citizen Advice Bureau, or which way that we turn if you need help?
I would say that the Macmillan support line is a good place to start, particularly if you have difficulty getting out and about as a result of your illness or your caring responsibilities, getting telephone advice. You can contact a benefit advisor at any point in your journey. But in relation to PIP, for example, if you're making a claim at the beginning when you've just been diagnosed and you're making a claim under the normal rules, you'll have a waiting period of 3 months before PIP applies to you. But it's good to have the advice at the beginning, but you can also come back for further advice at any point during your cancer journey.
Okay, all right. Thank you very much.
So I've got two general questions. One was, can you, if it's possible, give a quick overview if you're self-employed? Because I understand that impacts all of these categories. And then secondly, is there any development on earlier access to pensions?
Right, so 2 very good questions. The answer to the first question is no. Nothing is simple if you're self-employed. Yeah. So the one thing that is constant, regardless of whether you're self-employed, employed full-time, unemployed, we're looking for work before you were diagnosed. The one constant through that is PIP. It doesn't matter whether you're in receipt of any other benefits. It doesn't affect, and it's not affected by any other income that you have coming in. The self-employment and access to things like employment and support allowance can be dependent on your national insurance contributions. And again, this is slightly different if you're a director of a limited company or if you're a sole trader or in a limited partnership. So there's no simple answer to that question. It's one of those situations that we need to know all of the details. You can expect if you're calling for a full benefit check or an income maximisation check for the first time and you have no knowledge of the benefit system generally, you can expect that phone call to take between a half an hour and an hour at least. If you're self-employed, we'll need to ask all of the full situation before we'll be able to tell you whether or not you qualify for benefits. But PIP or attendance allowance if you're over state pension age or adult disability payment if you're in Scotland are the ones that are not affected by your employment. And your second question?
Potential earlier access to your pension.
That is not going to happen. So access to your pension, to your state retirement pension, there will be no early access to that. There was a campaign that went through to try and get this changed recently. It did not get anywhere. That is, I think, a bit of a travesty because the pensions benefits, so state retirement pension and pension credit, are worth more than any of the working age benefits. So this is something that I have a lot of issues with, but they're not making any changes to that. So the equivalent of the state retirement pension, a contributory benefit based on the contributions that you've made during the course of your life, the equivalent of that for working age claimants is employment and support allowance or contribution-based job seekers allowance, basically. Does that make sense?
Helps me, yeah.
Any follow-up questions?
No.
Okay.
It's not really a question. I just wanted to point out that if you do get PIP, you're entitled to a free bus pass as well.
Yes.
And I have found out recently that you may be able to use that bus pass on the local trains, depending on your council.
Yes, that's an excellent point. Thank you.
Yeah, I was just going to ask, under the special rules, if you claim under that, is that the same as completing a DS 1500?
Yeah, so the DS 1500 has been replaced by the SR1. A DS 1500 was produced if somebody had a prognosis of 6 months or less. They've gradually rolled out a change to that system. So initially, you could get an SR1 if you have a prognosis of between 6 months and a year, or between 0 months and a year. And that was phased in for certain benefits. It has now been phased in for all benefits. So the SR1, slightly more generous. The prognosis is up to a year rather than up to 6 months, which is the DS 1500.
Because I was told it was a bit like a postcode lottery. Some places and some, even Macmillan nurses would complete the DS 1500 initially, because they said that technically we're stage 4, and if our treatment was to stop, then we would die. But if it carries on, it does work, then we've got a good prognosis. So some have that view that you have got a good prognosis, and some view that say that we may not have. So it was really difficult, and they just said it was a postcode lottery, and in my particular area they don't complete them.
Right, okay.
So it was really difficult, because I was hearing a lot of people saying that that's the channel they used, but with where I live, they said no.
Yes. So there's a couple of things that you could do. I mean, like I said earlier on, prognosis is a very, very difficult thing to actually pin down. It can be very difficult indeed. You might find with ALK positive lung cancer, the prognosis generally is slightly better than if you have small cell or non-small cell lung cancer. ALK positive responds to certain kinds of immunotherapy better, is my understanding. I'm also not a medical professional, but that's my understanding. So it may just be that in some areas, the cancer nurse specialists aren't as familiar with your type of lung cancer and may apply the kind of general understanding of the prognosis of a stage 4 lung cancer, which generally speaking is poorer than it is for ALK positive patients. So in some cases, having a more clued up cancer nurse specialist or consultant might work to your detriment because they realise that you actually have longer than a 1-year prognosis, in which case it would be a claim under the normal rules. But you could, like I say, prognosis, I can't say this often enough, prognosis is a very difficult thing to predict. So if you get an answer that you don't like from one person, go to your GP. See if your GP will write you an SR1 or your consultant. They might not like you doing it, but you may get a different answer if you go somewhere else. Any more questions?
One general.
Okay. So, no, you can go for it. Your hand was up first, so yeah.
Can you give us a brief overview? Are we entitled to discount on our utility bills or any other household bills?
The short answer is not automatically. Speak to the energy advice team.
Yeah, that's our experience.
Yeah. Yeah.
Well, hi. I've just got up the government website, and it is actually national that the SR1 form has replaced the DS1500s.
Okay.
I'm a retired GP, and I always used to do the DS1500s, but if it's not happening in a certain place, it may be that there's a supply of old forms,
Right.
and that the GPs are not up to date with the changes. So, yeah.
Yes, that makes perfect sense. Thank you.
Can we all say thank you very much indeed for Sinead?